We are very excited to announce the development of St Vincents Private Hospital Werribee. I'm Ian Grisold, the CEO for St Vincents Private Melbourne, and within the Eastern Werribee Employment Precinct, this is a major announcement. I would like to acknowledge and welcome our special guests today, the Honourable David Davis, the Minister for Health, the Honourable Matthew Guy, the Minister for Planning, Mr Peter Seamer, CEO, Metropolitan Planning Authority, our Sisters of Charity that are in the audience, Sister Pat and Sister Margaret, thank you for being here today. As the Sisters of Charity, we highly value and respect those who've gone before us, and we acknowledge the legacy of the Sisters of Charity who have established St Vincents Private Hospital. Mr Bob Fairclough, the Mayor of Wyndham City, Kerry Thompson, CEO for Wyndham City Council, and also our doctors, staff and invited guests. We begin by acknowledging the traditional owners and custodians of the land on which we meet today, the Wurundjeri people of the Kulin Nation. We pay our respects to the elders, both past and present, and we extend the respect to all Indigenous Australian present. I would now like to welcome and invite Minister Davies to say a few words on the importance of this new hospital and the impact on the broader health system.
Thank you for the opportunity to speak, and I'll begin acknowledging Ian Grisold as the Chief Executive, Bob Fairclough as Mayor of the Wyndham City Council, Kerry Thompson, Chief Executive of Wyndham, Peter Seamer, the CEO of Metropolitan Planning Authority, my ministerial colleague Matthew Guy, the Minister for Planning, and parliamentary colleague Andrew Ellsbury, who does a lot of work in and around the area of Wyndham and is very focused on supporting his area of the city in the west. I also want to acknowledge the Sisters of Charity and note the long-standing work done by the Sisters of Charity in the healthcare sector, both public and private, and I think it is very much an esteemed history of which we can all be proud, and this is another chapter to be added to it. Also wanting to acknowledge the traditional owners and note their elders past and present, paying my respects to them. Melbourne's population is growing and growing fast. We've hit records over recent years, and that's a challenge for Minister Guy as Planning Minister, because it means a whole range of services need to be coordinated. He's done that through the Plan Melbourne and a series of other key initiatives. That large growth in population is a vote of confidence in Victoria, the state's position, the state's employment prospects, and the prospects that families and individuals have as they move to our state, as the natural population growth is there, but adding to that the significant interstate migration, but also migration from overseas. I'm very pleased to work in partnership with Minister Guy on the matters around health precincts, and what is important in Victoria is we have a balanced health system. We have a system that has a very strong public health component, but also a strong private component. And the recognition that the two of those need to work in unison, in partnership, is a critical part of what our philosophy and our focus on getting the best outcomes for the Victorian community in health are all about. So we see balanced development as a key part of it, and that is made manifest by the concept of health precincts. We're bringing together both public services, private services, training and education, as well as various supplier industries and support services, is an effective way of ensuring you can do workforce planning and also achieve the research and training and education objectives that you cannot always easily achieve as a private sector alone or as a public sector alone. So I welcome in this important area out in Melbourne's west the growth that the state has put into our public sector, and I was very proud to be opening new subacute facilities in Werribee recently at Mercy, and seeing the importance of that magnificent new public facility and the services it's going to provide to Melbourne's west. But this Involvement of St Vincent's as a private hospital, as a hospital providing services to the people of the West will be very important too, and it will add to the concentration of health services in that region, in that precinct, enabling us to work collaboratively with the private sector to achieve a very good outcome for the people of the western side of the city. So I'm proud to be here today. I'm proud to be working together with Minister Guy and with public and private sector partners to deliver outcomes that is in the interests of the people of Victoria. So I think Council can be proud of the work it's doing, particularly the work around Healthy Together Victoria, its focus on community-based health planning, and I know Andrew Ellsbury has been closely involved with that process as well, and the important involvement of the Growth Areas Authority in helping to coordinate a number of these steps as well. So Minister Guy, you may want to say something now too.
I'd now like to ask Minister Guy to talk. Minister Guy, 2 years ago, did acknowledge the acquisition of the land that we bought 4 hectares down there that now will be where the private hospital will be built. So I think he's got some synergy with that. Thank you.
Well, thanks, Ian. To the Mayor and CEO of the City of Wyndham, to the Sisters of Charity who are here, obviously to Andrew Ellsbury and Minister David Davis, Peter Seamer, to all of you ladies and gentlemen. The East Werribee Employment Precinct, what we're calling East Werribee, is a fantastic urban renewal opportunity. In fact, as the City of Wyndham will tell you and the State Government will reinforce, this is one of the most exciting urban renewal propositions in Australia's history. We are looking at nearly 700 hectares of urban renewal opportunity that will be commercial, residential, light industrial, a whole range of job-generating activities in an area that has been stagnant and dormant for too long. It's an area that is in one of the fastest growing areas of Australia. It's an urban renewal precinct that is on the doorstep of a place in Australia where there's nearly 70 babies being born every week. It's an area that is crying out for health services, an area that is indeed going to grow inexorably over the years to come. The precinct itself, East Werribee, as I said, East Werribee is the largest urban renewal proposition in Australia today. It is one that is going to see thousands of new jobs, thousands of people come to live there, and this can't be done without the services to match. As Minister Davis has said, when bringing health services to a fast-growing population like Melbourne's West, it's going to be a mix of both public and private. And this $95 million investment by St Vincent's, both $75 million into the hospital, $20 million through aged care, is a huge boost to the growth and future sustainability of what is going to be the capital of Melbourne's outer west, the East Werribee Employment Precinct. For years and years and years, this precinct was talked about as a dream, as an opportunity, as a possibility. We are now seeing this become an absolute reality. It's not just a reality on paper, and the Metropolitan Planning Authority have done a wonderful job in structure planning this precinct. It's actually happening. And this investment today, and I want to pay tribute to St Vincent's for having the courage, the strength and the foresight to invest into a precinct that within the next decade is going to be home to many thousands of people and many more thousands of jobs. And so it's going to change greatly, and not just change Werribee, but change the focus and the structure of Melbourne's outer western suburbs. It's going to be within 40 kilometres of Geelong, 35 kilometres of central Melbourne. It's uniquely placed to service both the markets of Melbourne's western suburbs and, of course, the northern suburbs of Geelong. A catchment there of around 1.5 million people, an area that is growing, as I said, one of the fastest in Australia, nearly 70 babies born every week. It's an area where health services are so important for the future. And, of course, the employment precinct itself, the suburb East Werribee, or the Werribee area, that is going to be one that, as I said, will inexorably change as well. Melbourne is not getting any smaller, as we know. Melbourne is one of the fastest growing western cities in the world. Melbourne's population has grown by nearly 80,000 people in the last financial year. And this is a great credit, but also a great challenge to all of us, either in local, state or even federal government. Melbourne's population as a metropolitan area will, on ABS forecasts, become the largest in Australia in around 20 years' time. So to do so, we have to manage our city's growth well, and we have to manage the services to match that population growth, and have to do that now. Looking at precincts like East Werribee, the first real jobs suburb in a growth area anywhere in Australia, is so important to get that right. This investment by St Vincent's is so important for the other side of the equation, servicing the population which will call that catchment their home. So can I just conclude by again thanking St Vincent's for the courage, for the work they have done, for their determination to be a part of one of the fastest growth areas in Australia, and indeed for their investment, not just for the people of Werribee, but for the people of Greater Wyndham and Melbourne's Outer West. Can I say to the local government, the City of Wyndham, who have done a wonderful job in being a part with the Metropolitan Planning Authority of bringing together a structure plan that is visionary, that is certainly unique, that will see a large level of growth in an area that has been vacant fields for a long period of time. My colleague Andrew Ellsbury, who has raised the matter of the East Werribee Employment Precinct, now East Werribee, for a number of years now. He has been a fierce advocate for this area to change and be different, one that will actually see an area for jobs as the priority and services before just putting more people in the western suburbs, and that's what we're seeing. And of course the work that my department has done with Minister Davis and the Department of Health to facilitate this announcement today is fantastic. To all involved, congratulations. It is a great day for St Vincent's, for the Metropolitan Planning Authority, and importantly for the people of Wyndham and the outer western suburbs. Thank you.
Thank you, Minister Guy. Thank you, Minister Davis, for your kind words and your support and your willingness to fit this into your busy schedules today. I'd like to go through some of the detail of what the hospital will be and the impact on the community. In the pioneering spirit of the Sisters of Charity and the foundress of Mary Aikenhead, 175 years ago, 5 sisters travelled to Australia in the hope to address the desperate need of health, education and community support. Today, we continue that remarkable mission to develop new services in Werribee for the Wyndham community. Like our pioneering sisters, we are responding to the real need in Melbourne's West. St Vincents Private Werribee will include services of obstetrics, maternity, cardiology, orthopaedics, ear, nose and throat, oncology, general surgery and rehabilitation. It will comprise of 7 theatres, a day procedure unit, a cardiac catheter laboratory, and also, as the Minister mentioned, that there'll be on-site 80 local residents of aged care. It is estimated after the community consultation, permits and detailed design, it will be built and operational in 2016. Total cost expected to be $95 million. Our mission encompasses dignity of the human person and for the common good. Dignity in terms of respecting citizens' healthcare needs are best addressed in their own neighbourhoods and communities. In advancing community good, it has met a real need for private healthcare in Victoria. It will also attract doctors, professionals, doctors, nurses, allied health that will live and work in the area. It will provide necessary support and complement the wonderful work performed by Werribee Mercy. The hospital will support 2,270 full-time equivalent employees, and when fully operational, it will care for 16,000 patients every year. Today, 1 out of every 2 mothers in the Wyndham area who give birth need to go outside the local community for their care. That's estimated at about 2,000 births and growing. Many currently travel to St Vincent's Private Fitzroy, and soon they'll have the St Vincent's Private choice in their local backyards. The new aged care facility will support residents with dementia, low, high and respite care needs, and for those residents with financial disadvantage. The aged care facility being developed on the same site as the hospital will provide an innovative model for efficient and effective use of resources. not only sharing the highly skilled clinical support, but also the back-of-house functions, food, environmental and engineering. We are especially committed to the people who are poor or vulnerable. This will be predominantly funded by St Vincent's Health Australia, and we do not underestimate the hard work and financial challenge that lays ahead. But with the support of the community, the business and a willing government, we will be able to fulfil the state-of-the-art facility in the western suburbs. In the coming months, some fundraising will be established and business and members of the community will be invited to contribute to this exciting new development. So I'd like to now show the DVD that gives you some vision of the future that is, will start to come to pass in the next year or so. Well, that's a fantastic vision of the future, and it's coming to us very soon. We'd like to acknowledge also the help of the Metropolitan Planning Authority and the East Werribee Employment Precinct for helping put that together with our own staff. An exciting announcement today, a courageous decision by St Vincent's Health Australia, exciting for the families of Wyndham, and also for our staff and doctors. A new Werribee private hospital, 112 beds and co-located with an 80-bed aged care, all delivered to St Vincent's commitment to excellence and high standards. We are committed to providing compassionate, innovative care to enabling hope to those we serve. Thank you for your attendance today. There is some refreshments, and maybe it's an opportunity to ask questions, but I really appreciate everyone's attendance. So thank you so much.